Are you sitting at home waiting and thinking and wanting to take a home pregnancy test before your scheduled HCG test? Keep watching to find out how I feel about that. Hi, I'm Dr. Marc, the fertility expert, and welcome back to Fertility TV, your YouTube channel dedicated to empowering your fertility. I've been helping couples from all over the world get pregnant for over 17 years with my virtual consultations and online fertility programs. If you're trying to get pregnant, subscribe and hit the bell so I can help you too. Okay, so I've heard this over and over and over again, and I know you sitting there at home watching this right now are thinking the exact same thing. I want to take a pregnancy test at home right now. Or I'm gonna do a pregnancy test before I go in for my blood test. I know it, I know you've thought about it. My answer to that is no. Don't do it, not at all. It's that simple. I could end the video right now and just say, no, we're done, don't do it. But I'm gonna give you a couple reasons why. So, these home pregnancy tests are not accurate enough. They're not predictable enough. You can have one that's expired. You can have one that's just doesn't work for whatever reason. You could have gone down to the dollar store and bought 3 dozen of them for $1 and don't even know if they work. It's not reliable. And on top of it, if it comes back negative, what are you gonna do? Stop taking your medication? Not show up for your HCG test at the doctor's office? I say those two things specifically because that's exactly what I've seen happen. I had a patient, not just one, although I'm gonna tell you one story about her, but in general, I've had multiple patients do this. They take a home pregnancy test, it shows up negative, they stop all their medication, they don't show up for the HCG test, and they don't even call the doctor's office. Then the doctor calls them, no answer. Call back the next day. Finally, they get a hold of them and say, you have to come in and take a pregnancy test. Not only do they want you to take it because they want to get a real answer, but they need you to take it because they have to document the results for their clinic. She went in, she took a pregnancy test, she was pregnant, but she stopped all her meds 3 days ago. Luckily for her, they put her back on her meds, everything turned out fine. She had a healthy baby. But that is dangerous, and that doesn't always happen. As much as you want to take a home pregnancy test before your scheduled HCG test, don't do it. It's not worth it. Just wait until you go in. The symptoms that you have after an IVF cycle don't mean anything. You're taking all this medication, and these symptoms can make you feel like you are pregnant, or you can have no symptoms at all and feel like you're not pregnant. And neither one is an indicator that you are pregnant or not. Neither one, because I've seen everything happen mixed and reversed. So don't trust your symptoms, don't take a home pregnancy test, and make sure you stay on your meds and go in to the doctor's office to take an HCG when you're scheduled to do that. I know that you're gonna wanna talk to more women going through the same thing, and that's exactly why I created my IVF Group Support program. To learn more, click right here. And I'll see you in the next episode. If you're watching this, it means you need the IVF code. Here, I share all the protocols that I've used to support thousands of patients going through IVF. This is the most comprehensive guide to prepare for IVF. Here, I teach you how to increase IVF success rates to 40% or higher. It's my gift to you. Click the link below or click here to get it for free.